you again. I want to be very brief and just welcome everyone to this very important and wonderful webinar. I'm absolutely thrilled with all of the speakers that we have with us today who are going to, I'm sure, present things that all of us will find incredibly valuable. I am Tanya Cassidy. For those of you who don't know me, I work in DCU, School of Nursing, Psychotherapy and Community Health. And I, with my colleagues at DCU, have organized this webinar with UCAM, and the chair of UCAM, Debbie Barnett, will introduce that more in a second, but also my colleague Aliette Orag from Israel, who I am absolutely thrilled. We've been working together for a couple of years now and on this topic, one we both find very important. So without further ado, I will turn it over to Debbie, who will give you some additional comments. Oh, the one technical point, please feel free to put any questions that you may have in the Q&A section. And I believe that our chat box is open for people. Is it, Justin, as well? Yes, okay. So we will try to monitor this as much as possible throughout and answer during the discussion sections we have. Okay, Debbie, I'll turn it over to you now. Debbie Barnett.
Hi, everybody. Welcome. Thank you so much for joining us. My name is Debbie Barnett. I am the current chair of the UK Association of Milk Banks. I'm also the coordinator of Milk Bank Scotland, the service that provides milk for the whole of Scotland. Just to say, this is such an important topic. We have many donors in the UK and certainly in Scotland who very kindly choose to donate after loss and bereavement, and we recognise how challenging that is, and I think it's an area that we can do better, and hopefully working with other milk banks across the UK, we will come up with a more unified approach. I'm certainly hoping that from the presentations from today that we will have a think about how we can approach this slightly differently, and that we can support those parents and families who wish to donate after loss. What I would also just say very briefly is that UCAM we've done a lot of work over the last 2 or 3 years, really trying to kind of increase our profile, raise awareness. We have a very nice new website with www.ucam.org, and we have done a lot of work on improving the website. We are working on our private members page that will be launched hopefully in the next month or so at the latest. We're just working on editing some of the videos from our forum back in May, and they will go up first, and then we'll have our forum from September, and then this forum will also go on to that. For health, I'm going to do a bit of a sales job. For health professionals, it's £5 a month or £50 a year to join, and for non-health professionals, it's £3 a month or £30 a year. And for that, you will get access to all those videos. You'll also get access to any future events for free, because we think, start to charge a small fee. And there'll be also other areas within that private members website. Our scientific advisory board are going to support us with some interesting commentary on some of the research, and that'll be available also on that private members area. So really, please consider joining us. We can't do it without the support of membership, and we really do want to see the I guess a growth of milk banking and milk banks in the UK to support the work we're doing. So I am very pleased and excited about today's topic, or today's forum rather. It's a difficult topic, but one that we really need to talk about, and just to say thank you to Tanya. Really, she's done a huge amount of work in organising this, along with Aliette from Israel. So thank you both so much, and I will hand back to you guys.
Okay, thank you so much, Debbie. I appreciate this, and it's a small charity, and it's one that I've supported for over 15 years now, and I'm thrilled that I'm actually part of the scientific board, and that's part of the reason why we've been holding these webinars, along with my colleague Simon Dahl, who's the chair of that board. So what we have decided to do is my colleague Alia and myself are introducing each of the speakers. And so I'm going to ask Alia to actually introduce our first speaker. So I'll turn it over to you. There you go.
Hello, hi, it's nice to see you all. So my name is Ayelet Oreg, and I'm very, very happy to introduce Debbie Noble-Carr, and if I'm not pronouncing your name correctly, so please correct me. So we are very much appreciate to have you here with us to discuss the research that you are doing, Debbie, with your colleague, the sociologist, Dr. Katherine Carroll. You are doing the research in Australia, and in fact, this is the week hours for you for tomorrow, and we are very much appreciate that you stayed late, so so late to be with us. So thank you. So Debbie is a social worker with over 25 years of experiences working with vulnerable families, and have spent much of her working life conducting qualitative research on sensitive issues such as grief and loss, with the aim of improving policy and practice in the health and welfare fields. And I know your work and Katherine Carroll's work for quite some time, and it's a pleasure to have you. So good luck, and I'm turning the microphone to you.
Hello, thank you, Ayelet. All right, so if you can click through to the next. All right, so I was just letting everybody know that what I was going to speak to you about today, and hopefully it'll be all smooth sailing from here. So yeah, so you can click to the next one. Thanks, Tanya. Okay, so I'm sure all of you realise that Australia is a vast country, but you may not be aware that we currently only have 6 human milk banks in operation. Perth was the first of the current day Australian milk banks to open 15 years ago and established in 2006. Each human milk bank has had to navigate their own unique challenges and barriers to become established, with each being regulated under different state legislative frameworks in Australia. One commonality amongst all of our banks is that milk donation is a voluntary and unpaid activity. However, donation of milk is often limited to mothers who live close by their milk bank or on their transport routes to allow for ease of collection and drop-off. The Mother's Milk Bank in northern New South Wales is a privately run milk bank and the only one in Australia to supply families in the community as well as hospital NICUs. You'll notice Canberra is not on the list here, and a recent cost-benefit analysis conducted by the government concluded that the development of a milk bank was not a cost-effective option for Canberra. Interestingly, any potential benefit for bereaved donors was not factored into their analysis. This is probably because bereaved donation forms only a tiny component of our relatively small human milk banking sector. From the human milk banks in operation, as far as I'm aware, Melbourne is the only one that currently does not accept donations from bereaved mothers. The milk banks in Sydney and Brisbane have recently been acquired by Australian Red Cross Lifeblood after they set up their first human milk bank venture in Adelaide in 2018. In a recent webinar I attended, Lifeblood reported that in a study of their 514 donors from the last 2 years, 3% were bereaved donors. So that's 16 mothers. Maybe if I point my finger, Tanya, you can click. So we're ready for the next one. Thank you. So as you may be able to infer, Australia's milk banking sector and particularly bereaved donation remains in its infancy. To this day, In Australia, we've seen little research, national policy discussion or organisational representation that has attended to the issue of bereaved donation. An Australian government report on donor milk banking released in 2014 completely overlooked bereaved donors as actual or potential donors. In the same year, my colleague, Dr. Katherine Carroll, published an important paper that reported on the first Australian stakeholder meeting that brought together all of the milk banks, NICUs, and a parent NICU organisation. The health professionals working in these NICUs and milk banks reported they operated within a context of a lack of precedent, guidelines, research, and testing regarding milk donation and bereaved mothers, resulting in each human milk bank developing their own unique guidelines on donor eligibility that, depending on the bank, can sometimes exclude bereaved mothers, mothers who did not have a baby born or treated in the hospital operating the milk bank, milk collected prior to donor screening, milk resulting from sustained expression following infant death, donation for more than 6 months, or mothers with a limited volume of milk to donate. Within and across each hospital or human milk bank setting, responses to bereaved donors were largely described as being ad hoc and based on professionals' best efforts to ensure the psychological and physical well-being of the bereaved mother. Some were concerned that sustained expression for the purpose of donation may not be in the best interests of bereaved mothers. This was in stark contrast to the perspectives and experience of bereaved donors from Australia and the US that Dr. Carroll was speaking to at the same time, who are able to articulate many benefits from bereaved donation. Thank you. After this project in 2014, Katherine was interested in doing a much larger study to learn more about Australia's bereaved lactation care practices and whether they're meeting the needs of bereaved parents. The first thing we did in this study was to conduct a review of the online information presented by Australian health organisations about lactation after infant death. So basically placing ourselves in the situation of a bereaved parent who may be seeking information. We'd completed an extensive literature review and stakeholder consultation to uncover what information should be presented to bereaved mothers. From this, we developed a 25-point lactation aid framework that meant if you met all of the 25 criteria across 7 different categories of information on your website, it would be considered that you were presenting complete information that would meet the needs of bereaved mothers. Upon reviewing the content of 21 health websites against this framework, we found information on lactation after infant death was not readily located on any of the websites. There was no reference to lactation after infant death, let alone bereaved donation, found on any of the website's homepages or as a subject area in their drop-down menus. By submitting key terms into the website search functions, we revealed just under half provided any explicit acknowledgement of breast milk or lactation after infant death. Lactation suppression was the assumed and sometimes only lactation management technique presented, and only 3 websites explicitly mentioned breast milk donation as a possible option for bereaved mothers. None of these detailed donation by sustained expression. Human milk banking websites did not contain any information tailored to bereaved mothers. None of the websites explicitly mentioned that bereaved mothers could be considered as donors. Most often, the milk bank websites contained information for donors alongside pictures of mothers holding healthy babies and only ever discussing eligibility in terms of a mother with a living baby. Thanks. One would hope that in the lead up to or in the wake of infant death, bereaved families and their supporters would not be placed in a situation of having to do their own furious Googling to gather options and look for information and support, but that instead, as part of their hospital care, bereaved families are presented with all of their options and supported to make an informed decision. Unfortunately, our second sub-study with hospital-based health professionals seemed to indicate otherwise. We held 17 profession-specific focus groups and 5 interviews with a total of 114 hospital-based and/or human milk bank staff. These were from 3 hospital sites in Australia's eastern states, 2 that had a milk bank on site and 1 that didn't. We discovered the typical hospital-based lactation care provided to a bereaved mother followed a distinct pattern across our 3 sites. I don't have time to walk you through the whole flow chart we developed of this care, but let's just track what needs to be in place for a mother to be presented with the option of bereaved donation. First, she would need to encounter a health professional with suitable awareness, knowledge, capacity, confidence, and comfort to discuss lactation after infant death. Then, if breast milk was visible and present, and/or if the health professional does not view lactation or breast milk as purely a physiological issue, I need a couple of clicks, Tanya. And one more. Thank you. So if the mother expresses an interest in expanded lactation management options, various options may be discussed and presented. This will only include milk donation if there is a human milk bank available and if the health professional deems the mum as eligible and appropriate to be considered for donation. Then she may be referred to a human milk bank for screening to become a donor and hopefully accepted and supported to donate either frozen stores of milk or milk from sustained expression. So I hope from this quick guide through the pathway we were able to develop, you can now begin to appreciate just how limited the access is to bereaved donation for the majority of Australian mothers, who are most often only presented with 1 of 2 suppression options or asked if they would like to discard their frozen stores of milk. Thanks, Tanya. These were just some of the quotes from health professional participants that confirm just how far away bereaved donation is from normal practice. An obstetrician who says, "I find it hard to fathom that a woman would want to stimulate her milk and donate milk and express for another baby when she's just lost her baby." A midwife who explains women are only offered information on suppression. A lactation consultant who admits the option to donate would not be presented unless a mother asks about it herself. And perhaps because this is a taboo subject for most people. And human milk bank staff who in exasperation state, we need to make milk donation more upfront. So it's not a secret society that you can access only if you know someone who knows someone who knows someone. Thanks. So although much of the presentation today has described bereaved donation as largely out of reach to mothers, I did want to finish on a note of hope and optimism. Due to proposed sampling, we were able to conduct interviews with 7 bereaved mothers and 5 of their partners who had found a pathway to milk donation. 3 couples had donated frozen stores of milk and 4 had donated milk from sustained expression that lasted from 2 months up to 6 months. These mothers represented a diversity of circumstances. One mother also shared informally as well as donating to a milk bank, and another mother donated frozen stores of milk whilst keeping some stores at home and then fed those to her subsequent child. Another mother donated to a milk bank, discarded milk that was left at the hospital, and also sought out the option of wet nursing through an online informal milk sharing site. 2 of the 7 mothers were from a non-English speaking background, with 1 requiring an interpreter for the interview. Our sample of 17 bereaved mothers indicated that many more would have liked to have been presented with the option to donate milk. For example, the majority of mothers wanted to use their breast milk purposefully after infant death. Mothers and fathers told us breast milk is a valued substance and breast milk and lactation practices can be significant to them prior to and during the life of their infant, as well as after the death of their infant. Many of these mothers asked about the option of donation, but were told this was not possible due to a human milk bank not being available in their area. When they were able to decide to donate, mothers often shared this decision-making with their partner. Almost 30% of our study mothers were lactating whilst pregnant, and over half of them had frozen stores of milk available at the time of their infant's death. Some didn't know what had happened to this milk that was left at the hospital. Some chose to discard their frozen milk. Those who were able to and who chose to donate it found this to be a relatively simple process if it could be facilitated by the health professionals at the hospital. Sustained expression for the purpose of donation was a greater commitment, often involving significant challenges for families. Fathers specifically spoke about the difficulty they faced attempting to support their partners, whilst also often taking on responsibility for running the household, looking after children, and even returning to work. All bereaved parents said that increased awareness, recognition, and support would be appreciated, especially regional and rural parents. Despite the challenges, parents said bereaved donation was definitely worth it. Donating mothers felt good that they could help other babies and or mothers. As this first quote from Samantha says, it made it feel like there was something good coming out of it all. For some mothers, this altruistic act meant they could incorporate strategies consistent with their values and their past coping into their grief. Grief scholars, such as Robert Nehemiah, remind us that incorporating meaning making in ways congruent to your identity and previous coping can assist with grieving. As this mum, Jessica, said, what can you do? I'm always the sort of person that if something happens in your life that's not good, what can you do to change that? What can you do to make it better? How can you pick yourself up, thinking of others and putting yourself in their shoes? Bereaved mothers also discussed donation offered a way to provide meaning, legacy, or a memorial to their own infant's life. Laura said her mission was to donate the milk to other babies. At 32 weeks of gestation, she accomplished so much in her life, really, donating the milk. Donation via sustained expression held additional benefits that many mothers said were significant. Mothers discussed how sustained expression provided purpose, routine, and meaning at a time when their grief would have otherwise caused them to collapse. As Jessica says, I couldn't just collapse down into myself. So I think the expressing the milk and donating the milk was keeping me up. It was my good thing that was going, you can do this. Mothers often then ceased expressing and donating when they felt emotionally ready to re-enter the world. So it gave me a routine and it gave me a purpose and a reason for getting up and getting out of bed. And then eventually, as my grief evolved, I was ready to close that chapter. Jennifer Wellborn also previously noted donation practices were helpful during this transition period when women are working through their grief. The act of expressing, producing, and supplying milk also provided mothers with an opportunity to perform acts of motherhood, providing felt links with other mothers and a shared experience. Wellborn again has previously argued that this is especially valued because it comes at a time when mothers feel stripped of their identity as mothers. So I guess it was something that I wanted to do, just part of being a mum. Some mothers said this could be strengthened if human milk banks facilitated connections with other donors and recipients, but the milk bank they were donating to didn't do that because of their confidentiality protocols. One mother also said that an added benefit of sustaining expression was the physical health benefits women can receive. Samantha also said her relationship with the human milk bank manager really helped fill a critical gap in support when the hospital and palliative care support suddenly fell away after her infant had died. One of the important discoveries from our research project was the finding that bereaved donation also has a positive impact on fathers' grief and meaning making. For example, dads also felt the altruistic nature of donation provided positivity and meaning amidst their loss experiences. Thanks. And donating offered them a way to memorialise their infant's life in a meaningful and special way. Thank you. Just similarly to what the mothers had said. We also know that many men often want to be instrumental when working through their grief. The men in our study provided significant support to their partners, especially those engaged in sustained expression, with men doing everything from being up with their partner in the night, washing bottles, sterilising the pump, making dinner, sitting with their partner whilst they were expressing, providing emotional care and support. This allowed them to feel intimately involved in the act and practice of donation. And in sharing in this process, they found purpose and meaning and sometimes healing. So as Chris says, as a purpose for her, there was a purpose for me as well. It was a shared duty, I guess, that we took on together. We did it together. Sebastian's comments also remind me of Eilert Oreg's findings with bereaved mothers on the ritualistic nature of donation practices. Sebastian says to do things for her. For instance, to take a mill of her breast milk, to put it in a container, to put it in the fridge, every week to take it together to the hospital, to do the process together. It's an internal healing. It was a healing process. So in summary, our research findings have discovered that Australia's human milk banking sector is currently relatively small and disjointed, with varying bereaved donation policies and practices. The possibility and practice of bereaved donation remains elided from public view. Breast milk donation is not routinely offered to bereaved mothers in hospital settings. Those wanting to donate come from diverse backgrounds and circumstances, and it makes it almost impossible to predict who may or may not want to donate milk after loss. Whilst donation of frozen stores of milk can be easily facilitated, donation from sustained expression required a greater commitment and involved challenges for families. Bereaved mothers and fathers can receive great benefits from donating milk that helps in their grief. And bereaved families want breast milk donation to be more available to them and indicate an urgent need for increased awareness, recognition and support of bereaved donation across Australia. For more information, please consult our published papers and those of others, and you can keep up to date with our research by visiting our project webpage or contacting us directly on the details there. And that's me done. Thank you, Tanya, so much. You did an amazing job.
Don't worry at all. Don't worry at all. Thank you, Debbie. This was a wonderful way to start. And I appreciate it so much that you've done that. We actually, my one thing, I apologize for not moving as quickly. I was reading the slides and not watching yourself. So,
no, you did a great job. I might cross to have you in all of my future presentations to be my page turner.
Thank you. So in terms of this, we don't have any specific questions yet, but I personally have found through the work that both you and Katherine are doing and have done very interesting and very valuable. In terms of questions that may come later as we're discussing things, because for Debbie, I know it's well past midnight for you there. And so what we will offer to everyone who's listening is we will also make sure that questions are forwarded to you and that they're answered and that people can interact with you, because sure. I think that one of the really valuable things about today's interdisciplinary international discussion are things that you pointed out here. And this is one of the wonderful things about what Katherine did. When I first started working with her, she was in my book, Ethnographies of Breastfeeding, and that was before she had left Australia to go to the States. And so I followed what she was doing in the States, because as you can hear, my accent is from North America. And so I've worked very closely with people there too. And so it's great that we have this And then ultimately, when I visited Australia, I was absolutely thrilled to continue to have these connections. And I know that time difference makes it difficult, but I do appreciate that you've done this. Alia, do you have anything you would like to add?
First of all, it was very interesting. Thank you so much. And I wonder if you can maybe elaborate a little bit about how did you engage with the partners? Like, how did you approach the fathers? I found it very interesting and very important topic, which also we'll have a later on while you will be asleep. We'll have a presentation from a colleague here from Israel, Nurit. She will present works with fathers, and especially interested because in Israel, and I know maybe in other places, but the role of fathers is very silenced and they're not getting any attention. So I just want to hear if you can elaborate about your experience.
Sure. Well, we found fathers were hugely significant and wanted to be involved, wanted to have information so they could support their partners, as best as they could. And were involved in decision making. In one case, it was the father who actually instigated the donation for the couple. So the way that we recruited fathers was through the mothers that we'd already recruited for the study. So we recruited mothers through the 3 hospital sites that we'd established partnerships with, and those hospitals went through their records and found to find who was eligible for our study and sent them out letters of invitation. So we only knew mothers who wanted to be involved if they contacted us directly. And then pre-COVID, we were able to travel around Australia and go into their homes and meet with them to conduct the interview. At the same time, we were able then to approach fathers and say, would you like to be interviewed for the study? Fathers weren't initially included in our study because they weren't covered in our initial budget and research grant, but we did seek and were able to find further funding to support us to talk to fathers specifically. So this funding enabled us to employ a male research assistant as well. So fathers were able to choose whether they wanted to be interviewed by a male or a female. I was doing the majority of the other interviews. In one case, I had visited a mother in a regional area of Queensland. It had taken me quite a long time to travel there, and she had experienced 3 infant losses, and her partner accompanied her for the interview, providing her with support. As you could imagine, it was a fairly full-on interview, and he decided at that point that he was happy for me to give me consent for that to be counted as his interview as well. And so I then asked him some more additional questions. That was the only interview we did together. Otherwise, they were completely separate, and we weren't looking about comparing people's stories. We just wanted to know what that lived experience was like for that one person and what their perspectives were. So we've sort of treated the data sets of mothers and fathers quite separately in our interviews and analysis in that way.
That's really interesting, Debbie. And we did get one more question here that I'd like to go slightly over and ask of you, because we have you here and we'll make up time later in the webinar. It's from Marion Copeland. She is the managing director for the Bristol Milk Bank, and they just celebrated their 10th anniversary yesterday. But Marion asked a question about if she said, first of all, that she found it very interesting what you were saying, and your points about partners were things that she hadn't thought about before, and it was very helpful. But she also asked if any of the mothers had been told that their milk wasn't suitable due to medications, and in terms of that, how did they feel?
Yeah, sure. One mother who donated her milk to a milk bank actually did so just for research purposes, because the milk was deemed not suitable to provide to an infant. So she gave consent for her milk to be used for research. And she said that she didn't care that it was being used for research or, you know, being used for an infant, because she said they need to know whether people taking these medications can donate milk in the future, and they need to do this research. So it's still really important, because it means that other people might be given the opportunity to donate in the future, like me, for, you know, for infants who really need it. So there was one mother who did that and donated for research purposes. That was something that was offered by the milk bank who she was donating to. I don't think that's something that all of the milk banks necessarily give the option for. And there were no other mothers who in our sample who were told they were ineligible because of that. Many of them were told they couldn't do it because it just wasn't an option that was available, because there was no milk bank in their area. And then other mothers were told there is a milk bank, but we don't accept from bereaved donation. So yeah, it was only open to a few. Yeah,
that's so important. Several points that you've made there that we'll definitely carry through for the rest of the webinar. Part of the issue about access to research is one that is certainly in across the UK. Not all of the milk banks have that either, but we have a system that we have to try to develop more, that we're going to talk about more. And I know in Australia, hopefully that's the plans for the future, for milk banks to work better together and offer things. So Debbie, I thank you so much for everything that you've contributed to our webinar. You're very welcome to stay as long as you can stay awake. And
yeah, I'll stay for a little while. I see how I go. I've got some adrenaline now from presenting.
Okay, great. So thank you again, and we do appreciate it so much. So
thanks for having me.